This is Lecture 19, Specimen Collection and Processing, Part 1. And this is Lindsay Clark. I am your primary instructor for current topics in medical laboratory sciences. You guys, the objectives for today's lecture. Number 1, explain the proper procedure for venipuncture and collection of blood specimens for laboratory testing. Number 2, describe the proper procedure for capillary collection and infant heel punctures. Number 3, select the best methods to deal with intravascular lines, blood cultures, and special clinical conditions. Number 4, state the order of draw and list additives in commonly used evacuated tubes. Number 5, explain key points related to collection of lab specimens other than blood. And number 6, identify information that must be included when labeling specimens and explain when and where labeling must be performed. So just a quick outline of what we're discussing today. I have a few general comments about specimen collection. Then we'll discuss phlebotomy to include the proper procedure for venipuncture, precautions to take, and special considerations you should be aware of. We'll also talk about the order of draw and tube additives, and then move on to collecting other specimens like urine, body fluids, swabs, sputum, so on. And finally, we will discuss labeling specimens in a little bit more detail. First and foremost, I want you to know that the test and the results are only as good as the specimen on which it is performed. Unfortunately, many of you may not have any control over the collection process at your facility, but it is important to know when to make the call to reject a specimen and when a specimen is acceptable. Your facility should have a policy in place for specimen rejection, so always follow that policy. I also want you to know that you should never accept an unlabeled or mislabeled specimen. I know that special circumstances exist and exceptions are sometimes made, and this can especially happen for specimens that are difficult to collect. That can include spinal fluid and bone marrow, joint fluid, and that type of thing. Whatever your facility's policy states, always follow that policy. And please, always wear your PPE when you're collecting specimens. Be aware if you are going into a patient's room and that patient is on isolation, you might need extra PPE. For instance, if the patient has TB, you're going to want an N95 mask when you go into that room as well as other required PPE. Wear it, protect yourself, keep yourself safe. It is so important that phlebotomy is performed properly because blood is the most commonly tested specimen in the lab. Before you do anything else when you're drawing blood, you should always identify your patient. Verify their name and date of birth at a minimum. Make sure you select the correct equipment and supplies for the situation. If you are drawing a healthy adult, you might want to use a vacuum tube collection system. If you're drawing a small child, on the other hand, you may want to use a butterfly system. You also want to make sure your patient is positioned properly. Make sure you have easy access to the draw site so you aren't awkwardly leaning over the table or the patient's bed. Your patient should be sitting or lying down. Never let them stand for blood draws. That's a recipe for disaster. Some labs lab tests can be affected by positioning, such as there's some proteins, some enzymes, and some hormones that can be affected. So always make sure your patient is properly positioned. The order in which tubes are filled is based on the additives that are in the tubes, and it's in place to avoid contamination or carryover. So the image here shows the more common tubes in the order that they should be drawn from left to right. Always start with your blood cultures, then move on to the other tubes that you need. So a quick note about these blue top tubes. These tubes have sodium citrate additive and they are used for coagulation testing. You all probably remember that those tubes must be filled to the line on the tube or the additive to blood ratio is off and your results are not going to be accurate. So, if you are using a butterfly, you want to make sure that you draw a waste tube first in order to get the air out of the line. Otherwise, that air is going to be sucked into the blue top and the blood is not going to fill up all the way to the line. Some order of draw guides will say that you should draw serum tubes before the blue citrate tube, and it could be because of this situation. That way you always have a tube before your citrate tube so it will fill properly. If your hospital or facility has a certain policy on how they want you to draw, what order they want you to draw in, again, always follow that policy. So let's briefly go over the steps for performing a venipuncture. Again, always identify your patient first. I've said this how many times so far? That should clue you in that I want you to know that. Make sure you explain the procedure to your patient. Always ask them if they have any allergies or sensitivities. If they're allergic to latex, make sure there's no latex in your gloves or any other supplies that you're using. Again, position your patient properly. Wash your hands and make sure you put gloves on. Protect yourself and protect your patients. Choose your puncture site and then get your equipment and supplies ready. Once you are ready, you can apply the tourniquet and perform the venipuncture. Ensure that all your tubes are adequately filled. Remove the tourniquet and then remove the needle. Tourniquet first, then needle. Instruct the patient to hold pressure if they are able, and during that time, you can use that time to discard your needle. If it's necessary, put a bandage on your patient. Label your tubes. When are you going to label your tubes? Where are you going to label your tubes? We're going to talk about that in a minute. And then finally, clean up after yourselves. People following behind you are not your mama, and it's your responsibility to keep your area clean. So properly labeling your tubes is vital. Make sure the labels are straight, not wrinkled, not twisted, not stuck over the lid, whatever else. They need to be straight and wrapped around the tube just like is shown in that illustration there. Always label your tubes after you draw them and always label them at the bedside or while the patient is still present. I want you guys to know this. When do we label tubes? Everybody, after we draw them. Where do we label tubes? All together now. At the bedside. Okay, so now you know that. You're never going to forget it, right? Okay. A bit of a side note. So I found this little saying at the bottom of this little illustration. It says, get it straight, reduce the weight. That's on point right there. So labels that are janky, ultimately they're going to delay your results. Somebody's going to have to pull that tube off the line or pull it out of the analyzer or set it to the side to be relabeled or whatever. It's going to have to be relabeled. Maybe it'll be delayed by a few minutes, maybe by half an hour, never know. That's why labeling your tube properly is crucial. And again, I understand that you guys may not have control over that, but always use opportunities to educate others in your hospital, whether that's nursing, phlebotomist, patient care techs, whoever draws in your facility. Some precautions to take if you are performing phlebotomy. Be aware of allergies and sensitivities. And again, latex allergies are serious. So always make sure you're using latex-free gloves and latex-free supplies if your patient has a latex allergy. And you can see in the image here, that's a reaction to latex. This patient has an allergy, they reacted to the latex, and that's a pretty serious reaction. So you certainly don't want to cause that. Now, some bandages contain synthetic materials that can irritate skin for some people. Coban wrap is a really good alternative to use. So you always want to make sure that you have alternatives to anything with latex in it or bandages that might be irritating. If you are doing inpatient draws, always put the bed rails back up and clean up your supplies. Especially if you lay things in the bed to be able to reach them, clean it up. Certainly there are tons of stories out there about people leaving needles in the bed with the patient getting stuck, causing lots of problems and paperwork for people. So you never, never, never want to do that. If your patient has an IV, you want to draw from the opposite arm. However, if you have to draw from the same side as the IV, draw below the IV. Never draw from a line. And if I don't care if it's an IV, a central line, a PICC line, whatever it is. Only nursing is allowed to draw from lines. So if anyone tells you that you are allowed to do that, really you're not. Or you should not. For chronically ill patients or long-term stay patients, be mindful of sites that have been drawn repeatedly. So not only is that uncomfortable for your patient, but it can cause erroneous results if you're repeatedly drawing from the same site. Especially if you think about you have a hematoma there or some bruising, that can affect your some of the lab results. Some special considerations may be made for certain circumstances. You may consider doing a capillary collection if you only need a very small amount of blood, especially in situations where the vein is difficult to access. So if you have a burn patient or you have a patient that's in a cast or a full body cast or something to that effect, consider doing a capillary collection. Capillary collection is also acceptable for many of the point of care testing procedures that are done on the floor in hospitals. So you'll see that done for those as well. Infants 3 months old or less can have heel punctures performed. So in this case, you should only stick the fleshy side of the heel. So you can see in the image with the little green lancet there, where they're puncturing the heel, that's where you should puncture for an infant on the heel. Now this is often done to collect for newborn screening cards. The cards for the newborn screening, they're made out of a special paper and they have little circles on them, and they must be filled with blood. Not too much, not too little, but kind of just right. And you can see in the image there at the bottom the little circles, and those circles are really well filled. This is kind of a neat little special paper they're collected on. So these generally get sent to your state health department for newborn screening testing. So they used to call these PKUs because that was what they tested, but now there's a whole panel of stuff they test. And these little blood circles, they have a pretty long storage life, and you can actually extract DNA from those. There's procedures that have been validated to extract the DNA from the blood on those little circles, so that's pretty cool. Blood cultures. Blood cultures have some special rules for when you're collecting them. First, you want to make sure the skin has been scrubbed with an appropriate cleanser. Scrubbed. If it's not properly scrubbed, the blood cultures can become contaminated. So this can result in a really costly workup in micro and potentially lead to unnecessary treatment for that patient. So if you think about what's on your skin, as far as bacteria goes, normal flora. Some normal flora can be opportunistic pathogens or cause infection in some patients. And so occasionally micro is not able to determine that that is a contaminant, and they end up having to work it up, and that patient may get treatment based on that. So you always want to make sure that your skin on the patient is very, very clean. You shouldn't repalpate a vein anyway after you cleanse the area anytime you're drawing blood, but especially when drawing blood cultures, because if you've cleaned it off, you've cleaned it adequately, and then you touch it, again, you're risking contamination. Also, A lot of people think that the tops on the blood culture bottles are sterile because you have to pop that little lid off, but they are not sterile. And you should actually clean the top of those with an alcohol pad, let it dry, and then fill the bottles. So always make sure that you fill the aerobic bottle first, then the anaerobic bottle. Those two bottles make one set. If you can't fill both of the bottles, you should fill the aerobic bottle. That's the more important bottle. And then there are also pediatric bottles. So for pediatric patients, they only get one bottle drawn, and it requires a lesser amount of blood because nobody wants to drain the baby of all its blood, right? So in general, for blood cultures, they will order 2 sets to be drawn. They want them drawn at least 5 minutes apart from 2 different sites. And this is a way, again, to help ensure that any growth in those bottles is indicative of an actual infection and not contamination. So in the images here on the left, these are blood culture bottles for a certain type of blood culture machine or incubator. The blue, in general, the blue cap is aerobic, and that kind of maroon cap is the anaerobic bottle with the pink label. And then the yellow one is the pediatric bottle. And then the image on the right, these are actually glass bottles. I believe this company is moving to plastic bottles, which obviously safer in case you drop it. So you can see on the 2 bottles on the right, that's your anaerobic and your aerobic bottles. And then the one with the little gray lid on it is your pediatric bottle. So you can see it has a little bit less volume in it. It requires less blood to go into it. And then Oprah in the middle, she's not wrong. A lot of times they will just order blood cultures on everybody. And it will just be a blood culture kind of day. Some of y'all totally get it, I know. Other special considerations. So if your patient has had a mastectomy, you should not draw from the same side where they had that surgery. In the illustration there, you can see that when they remove the breast, they also remove the lymph nodes. So putting a tourniquet on that arm can actually cause a lot of issues for those patients because they have no lymph nodes on that side. If that patient has undergone a double mastectomy, you may need to draw from the foot or consult with the patient's nurse or their provider and see what's the best course of action for you. If your patient has any edema or swelling present, you should avoid that area. If you have a dialysis patient that has a shunt in their arm, you should not draw on that side. So it's kind of a similar situation to the mastectomy patients where putting a tourniquet on that arm can actually cause a lot of trouble for those patients. Now, again, if your patient has an IV or if they have a cast, you should draw from the other side. But if you have to draw on that side for some reason, you always want to draw below the IV or below the cast. And never draw from a thrombosed vein. So if you have a vein, they've got some thrombosis going on, don't draw from that side. So we're going to talk about order of draw, and I know we've kind of already mentioned this a little bit, but I like this image too because it's got a couple special tubes that you may run into in your career. So let's talk about these. And the order of draw here is from left to right. So first here we have our blood culture bottles. Again, those should always be drawn first. This weird little yellow tube here, this is actually called an isolator tube, and it is used for mycology testing, so AFB and fungus workup on blood. So these can be drawn. They are generally stored at room temperature, and they can be used to test for fungus or acid-fast bacillus organisms in blood. Next, we have this royal blue top. These are for trace metals or heavy metals. there's actually two different royal blue tops, and one has an EDTA additive, and you can see, if you can read that tiny label there, this particular one has no additive. So some metals will require the EDTA and some metals will require no additive, and you just will have to look up whatever lab you're using or test methodology, what the preference is for that. These blue top tubes, I'm sure you guys are all familiar with. The light blue, they have sodium citrate in them, and they are used for coagulation testing. So here, the solid blue on the left is an adult tube, and the tube on the right that has kind of that clear overlay, that is a pediatric tube for this particular brand of tube, and these are BD Vacutainers. The red and gold. So the red top has no additive in it, and the gold top is a serum separator tube, and you can see that gel in the bottom. I'm sure you guys have all seen these when you spin them down. The red cells collect below the gel and your serum stays above the gel. So these are great because you can pour them off without having to pipette anything. Less chance of getting your red cells in there with your serum. So both of these tubes are used for serum. So anytime you have serum testing. Then we have our green top here. This is a sodium heparin or a lithium heparin. Both of those are green tops, and these are used mostly for chemistry testing. Here we have our purple top or lavender top, and then the pink top. These are both EDTA tubes, and I think specifically K2 EDTA tubes. These are used mostly for hematology and blood bank. This weird little black top tube here that's super skinny, I've actually never seen this tube in person, so I had to look this one up. It's actually used for an ESR. I don't think these are very common. If you have them in your lab, that's pretty cool, but I've never seen these in person. Now the gray top, it is a sodium fluoride potassium oxalate additive, and these are used for lactic acid testing, and they for lactic acid need to be sent to you on ice, and they need to be run relatively quickly. Your lab will have a procedure for that will spell out exactly how long after collection it can be run, what to do if it's not sent down on ice, that sort of thing. And then lastly here we have this weird looking yellow top tube. This is an ACD tube, and it's got either solution A or solution B in it. So again, the tubes look exactly the same. This one, if you can read that tiny label, is solution A. These kinds of tubes are used for sometimes for HLA testing or maybe flow cytometry. And they are used sometimes for different reference tests that you would need to send out. So you'll run across those every now and then. Quick note about these. This yellow top tube looks very similar to some of the urine tubes that are out there. And so I know at some of the bigger facilities I've worked at, occasionally we would get some urine sent down in this tube because it looks so similar to the urine tube. So you always want to make sure if you see something like that, that you have them recollect it in the correct tube. Speaking of urine, there are several different ways to collect urine, and it really depends on what testing is being requested. So a clean catch urine should be collected by the patient or by nursing staff if it's an inpatient. So for a clean catch, the urinary opening must be cleaned, and the urine should be collected midstream. So you always want to collect midstream. If you collect that first bit of urine, it could be contaminated with normal skin flora. So if it's sent for micro, you may end up working up normal skin flora. They prefer a first morning specimen because it's more concentrated. That a lot of times is not the case, and that's okay too. And you always want to mix these specimens before testing. And these are used for random urine tests. So urine that is sent for just kind of a general UA or a culture, that's where you would you see a clean catch specimen. So the image here at the very top with that blue top cup there and the little tubes next to it. So this is a little urine collection kit that a lot of facilities have now. So what happens is the urine is collected in the cup, and then the tubes that come with it are filled. They sort of push those little tubes down. There's a needle built into the lid, and so you can see in the image there kind of to the right how they're filling that tube. That yellow top urine tube is used for urinalysis, and then the gray top goes to micro for culture. And that gray top tube has a preservative in it. It really shouldn't be used for urinalysis. So you can see in the image there that yellow top tube and how similar that looks to that ACD tube that we were just talking about. So you can see how those would pretty easily be mixed up. So you always want to pay attention to those. Now, what we used to call in the labs that I've worked in a dirty urine, these can be collected for some sexually transmitted infection testing. So you can collect these without cleaning. Basically, you just have patient pee in a cup. Don't worry about any midstream catching, cleaning, anything like that. And you can see the two images in the right there. Those are tubes that are for urine collection. So you would collect the urine in a cup and then transfer it over to these tubes. They have fill lines on them. And these are actually collection kits that are used specifically for chlamydia and gonorrhea testing. So the one to the left there, that is for a GeneXpert system, and then the one to the right there, that's called an Optimus tube, and that is a GenProbe testing system, which is Hologic is the one that I think builds those instruments. So those are for PCR testing for chlamydia and gonorrhea. So that's where you would see dirty urine. 24-hour urine specimens, they may be collected for quantitative chemistry tests. So maybe a 24-hour urine protein or a 24-hour urine glucose. I believe they collect these at some point during pregnancy and test 24-hour urine specimens. So you'll see that from pregnant women pretty often. So the orange jugs up there, those are collection containers for 24-hour specimens. And a note about these, they really need to be refrigerated during collection. And then urine cultures, we've talked a little bit about. They must be collected in a sterile container, and it should be a clean catch specimen. It can be collected in those little gray top tubes that we talked about, or it can be collected in a sterile cup. So that image there of the sterile cup, you see it has the little sticker that goes over the lid there that you have to break that sticker. That's there to make sure that you know that it's sterile, and once you break that little sticker open, you can't really consider that a sterile cup anymore. As far as if you were to find one and that little sticker was broken, throw it away, get a new one, give it to your patient. So if you have a specimen sent to micro in this cup, or a specimen that's collected in a sterile cup, and maybe it's has cultures ordered on it and urinalysis ordered on it, or chemistries, micro should really get that cup first and set up their culture, and that way that helps prevent contamination. So once they've set up their culture, they can send it on for UA or chemistries or whatever else is ordered on it. Collecting body fluid specimens. Body fluids that we see in the lab can include spinal fluid, or CSF is what we call it, pleural fluid, pericardial fluid, peritoneal fluid, as well as joint fluid. These are all collected by a licensed provider. Unless it's something that's collected out of a drain, nursing can collect from drains. Licensed provider, when I say that, I mean a provider on the level of an MD or a DO. Sometimes APRNs or PAs can collect these also. Common tests that are ordered on body fluids can include cell counts, chemistries, and cultures. Usually these specimens are considered stat, so sometimes the elements can easily degrade over time, so you want to make sure that you test it very quickly. The top image here is an illustration of how CSF is collected, and I just want you guys to see that in case you've never sort of seen that. I want you to know how precious these specimens are. Think about if you had that needle stuck in your spine, you wouldn't want to have to do that again, so always make sure you're careful with these specimens. And the bottom image shows these are common CSF collection tubes. These tubes are numbered, so if you can see in that little pink circle there, that tube has a little number on it. These should be collected in that order. Number 1 should be collected first, number 2 should be collected second, and so on. And the tubes actually should be distributed to different departments accordingly. So for instance, micro should not get tube number 1 because it's possible there could be some normal flora contamination just from where they punctured the skin. So micro doesn't get tube number 1. So generally labs will have a set policy for which department gets which tube. Stool specimens, they are generally collected by a patient or by nursing staff. If cultures are ordered, a sterile container is preferred, although that's not always the case. Common tests that they order are cultures, and when they order cultures, they really are looking for Salmonella, Shigella, Campi, things of that nature. They will order occult blood, fecal fat, maybe an OMP, which is an ova and parasite. That's your parasitology collection. And then more recently, they have GI panels that can be run by PCR. And so occasionally they will collect stool and have it sent for a GI panel. Bone marrow specimens are collected again by licensed providers. Sometimes these are collected and they're guided by CAT scan, so CT guided collection. So as you can see in the image on the left, this is not what I would call a comfortable or painless procedure. So again, just like spinal fluid or any of those other fluids that are difficult to collect, you just want to treat those specimens very carefully. Tests that are commonly ordered on bone marrow specimens include biopsy. They do chromosome analysis on these, flow cytometry, molecular tests, and then sometimes they will send these for culture. Other specimens sent to the lab include swabs, sputum, seminal fluid, sweat, saliva, hair, tissue. You might get fingernails or toenails, all kinds of fun stuff. So swabs that are sent to the lab might be sent for culture or sometimes for PCR. They might be swabs from a wound, or they might be swabs that are sent for flu or strep or group B strep in pregnant women, that kind of stuff. Sputum is usually sent for culture. A gram stain is generally performed to determine the acceptability of the specimen. So you want to make sure it's actually sputum, not spit. Spit can have normal oral flora in it. You don't want to work that up in micro. You want to make sure it's actually sputum that you're working with. Seminal fluid would be sent for semen analysis. There's not a whole lot of labs out there that do that. Generally that might be sent off or done elsewhere. Sweat might be collected. An example could be for a sweat chloride test for an infant, which is a confirmatory test they do for some of the newborn screening. Saliva might be sent. You can do genetic testing on that. You might get hair for drug testing or heavy metals testing. Tissue is usually sent for culture, and if you're lucky enough to get fingernails and toenails, those are generally sent for fungal culture. So finally, let's talk a little bit more about labeling specimens. So the information required on labels is controlled by regulations. This means that you should check your accrediting agency's requirements and follow them. Again, label tubes after they are drawn. Label them while you're still with the patient. So this goes for tubes as well as other specimens. If you hand a cup to a patient and they fill it with urine and bring it back to you, that is when you label the urine, and you label it while that patient is still there with you. Required information for labels includes, at a minimum, patient name. Usually the date of birth is included. They need an ID number or a medical record number, the date and time of collection, and the phlebotomist's initials, or whoever drew or collected the specimen needs to initial it. So just a note, there are special requirements for blood bank labels. So whatever your blood bank's protocols are, you should follow them. And I can promise you that your specimen will be rejected if you don't follow them. So make sure that you know what they are and that you always follow those protocols. So the top image here is an example of how not to label tubes. So most of you probably know that those are not going to make it through your analyzer, especially if your analyzer has a line on it. And then for specimen cups, you should always label the cup. So the label goes here, and never label only the lid. If you want to put a label on the lid, great, but you must always label the cup, not just the lid. And the reason for that is if you take the lid off of that cup, you set it down for a minute, you get distracted, someone comes along, here's a cup of urine that is actually not labeled. You can run into a lot of problems that way. And if you're going to label the lid as well as the cup, you need to make sure when you put that lid back on that cup that those labels match. That's a really easy way to end up with a specimen that you actually don't know who that belongs to. And that's not good for anybody. So just make sure that you're careful with your labeling. Again, I know that you guys may not have a whole lot of control over this, but it's a really, really great way to educate. So should you come across some of these things and you have to reject this specimen and you call for a recollection, that's an opportunity to educate. So I know that some people are open to that and some people are not, but especially if they're open, educate them. Just, walk them through this is how it should be done and this is why. A lot of times if people understand why it's done that way, they're more apt to follow that recommendation or that requirement. So that brings us to the end of this lecture. I have uploaded a few resources for you guys in Blackboard specifically for tubes and the additives in them and the order of draw. So these are really for you to look over and for your reference. Don't memorize them by any means, but I want you to know where to find that information. What's in that tube? What are they commonly used for? Especially some of those special tubes. So as always, if you have questions, comments, or concerns, you guys should hopefully know how to reach me by now. If not, there's my information. And finally, here's your references for this lecture.